Up to 60% of postmenopausal women experience severe vaginal dryness. But here's the statistic that completely shocked me when going through our research today.
Oh, the 20% figure.
Yeah, it impacts nearly 20% of women under the age of 50. And very often, the culprit is actually the exact birth control they rely on every single morning.
Which is wild, right?
It really is. So, welcome to the deep dive. We are looking at a stack of medical guidelines, clinical studies, and patient surveys to answer a critical question for you today. Does your choice of contraception actually cause post-treatment dryness? And, if so, how do you fix it?
Right, because it's essentially a systemic drought triggered by a single intervention.
Exactly. When you think about a lush, thriving garden, you understand that everything is connected. The soil moisture, the exact amount of sunlight.
The specific nutrients.
Right. It is this delicate, interconnected ecosystem. But imagine you introduce a new fertilizer. Your goal is just to stop one specific type of weed from growing.
And works perfectly for that weed.
It does. But a few months later, you notice the leaves on your favorite plants are brittle, the soil is cracking, and the whole garden is just completely parched.
Yeah, and you would probably spend a long time trying to figure out what went wrong before you ever blame that highly effective fertilizer.
Exactly.
And because things like hot flushes and night sweats get all the mainstream medical attention, vaginal dryness remains this silent epidemic.
Yeah.
It creates a deeply frustrating cycle for the patient who is just trying to manage her reproductive health, only to be hit with a side effect that nobody warned her about.
And honestly, that 20% statistic is likely underreported because this is such a deeply personal topic.
Oh, absolutely.
It is not exactly something that most people bring up at dinner or even with their general practitioner. People assume it is just a personal failing or that they are just suddenly losing their sex drive out of nowhere.
Yeah, they internalize it.
Right. So I was looking through these NHS guidelines and I realized we have to start by looking at the most common method first, which is the daily pill. Because to understand the side effects, we really have to look at what those synthetic hormones are actually doing to the body's baseline.
Yeah, to understand the dryness, you have to look at the mechanics of combined oral contraceptives, or COCs. They work by introducing extra synthetic estrogen and progesterone into your system.
So it's an artificial flood of hormones.
Exactly. The primary goal, of course, is to suppress your brain from sending the signal to your ovaries to release an egg, stopping ovulation entirely.
Right.
They also thicken the cervical mucus to create a physical barrier. But flooding the body with those extra synthetic hormones causes a significant chain reaction.
Which hits the natural hormone.
Right. First, they suppress the body's natural hormone production, including testosterone.
Wait, testosterone? I think we often label testosterone as a strictly male hormone, right?
We do, but it is fundamentally crucial for women's reproductive health. It helps keep vaginal tissue strong and supports the natural neurological and physical processes that lead to arousal and lubrication.
So by suppressing the natural baseline, we are already cutting off the fuel supply for natural moisture.
Exactly. And we are compounding the issue in the bloodstream. When you take oral estrogen, it passes through your liver.
Okay.
The liver reacts to this by dramatically increasing the production of a specific protein called sex hormone binding globulin, or SHBG.
SHBG.
Got it.
And SHBG does exactly what its name implies. It binds to sex hormones floating in your blood, particularly your remaining free testosterone, and just locks them up.
Oh, wow.
At the same time, we have recent clinical data, specifically a 2023 study showing that oral contraception can physically reduce blood flow to the pelvic region and the genitals.
Okay, let's unpack this. SHBG is basically a protein that acts like a padlock.
Yeah, that's a good way to look at it.
It binds to the hormones in your bloodstream, making them completely unusable by your tissues. So if we look at the whole picture, taking the pill is essentially turning down the water pressure in your house, which is the reduced blood flow,
while simultaneously putting a heavy padlock on the tap itself, which is the SHBG binding up all the usable hormones. When you lay the mechanics out like that, of course things are going to dry out.
Yeah, what's fascinating here is how the tissue itself physically transforms in response to that locked tap.
Really, like a structural change.
Literally. Natural estrogen is vital for keeping vaginal tissue elastic, thick, and well hydrated. It maintains the vaginal flora and a healthy acidic pH that fights off infections.
Feels protective.
Highly protective. When those synthetic hormones from the pills suppress your natural estrogen production and the SHBG locks up the testosterone, the tissue doesn't just feel dry, it changes on a cellular level.
Wow.
It becomes thinner, significantly less elastic, and much more fragile. It is a medical condition known as vaginal atrophy, and it means the tissue can easily tear or become inflamed.
That sounds awful. And the real-world impact of that physical transformation is massive. We reviewed a patient survey by a health platform called The Lowdown, and they found that 51% of progestogen-only pill users reported a noticeable reduction in their libido.
51%. That's huge.
It is. Think about the psychological toll of that. You take a pill to have control over your body and enjoy your life, and the result is that half of the users completely lose their desire for intimacy.
Which is an entirely predictable outcome when you look at the chemistry.
Right.
If the tissue is physically fragile, thinned out, and lacking adequate blood flow, arousal is physiologically much harder for the nervous system to achieve. The body is essentially throwing up a stop sign because it lacks the structural integrity to proceed comfortably.
It creates a really brutal feedback loop for the listener. I mean, if the tissue is atrophied, sex physically hurts. If it physically hurts, your brain registers anxiety and your desire drops.
Exactly.
And if your desire drops, you produce even less natural lubrication, which means the next time, there's even more pain.
It's a terrible cycle.
So if swallowing a pill floods your entire system, locks up your hormones, and triggers this systemic drought, the obvious workaround is to stop medicating the whole body and just target the reproductive system directly.
Right.
Which is why so many women switch to an intrauterine device or an IUD.
Yeah, IUDs represent a completely different philosophy of drug delivery. Let's look at the hormonal IUS first, like the Mirena coil.
Okay.
Instead of traveling through the digestive tract and the liver, it releases a progestogen called levonorgestrel directly into the cavity of the uterus.
So it skips the liver entirely.
Precisely. Because it is highly localized, the hormones are concentrated right where they need to be to thin the uterine lining and thicken cervical mucus. Only a very small trace amount actually enters the systemic bloodstream compared to taking an oral pill every day.
And our sources, including the official NHS guidelines, back this up. They do not list vaginal dryness as a common side effect of the hormonal coil.
They don't.
In fact, for women dealing with incredibly painful conditions like endometriosis or just severely heavy bleeding, the hormonal IUS can actually improve their overall sexual comfort.
Right, because it manages the underlying condition.
Exactly. It drastically reduces the chronic pelvic pain they were experiencing, which removes a massive psychological and physical barrier to intimacy.
Yeah, it allows the baseline natural hormones to largely continue doing their job while managing the localized pain.
Makes total sense.
And then on the other end of the spectrum, you have the copper IUD, which is entirely hormone-free.
Zero hormone.
Zero. It uses copper ions, which are naturally toxic to sperm, and it creates a localized inflammatory response that alters the cervical mucus to prevent fertilization.
Wow.
It boasts an effectiveness rate of over 99%, and depending on the specific model, it can provide reliable contraception for anywhere from 5 to 10 years.
Okay, wait a minute. I have to challenge this based on what we see in patient communities.
Sure.
If the copper IUD has absolutely zero hormones and it doesn't suppress your natural baseline, why do so many patients jump on forums and social media to complain that they completely dried up right after getting one fitted? Are they just misinterpreting their own bodies?
No, not at all. The symptoms these women are experiencing are very real, and their pain is valid.
Okay.
But when analyzing medical data, we have to strictly separate coincidence from causation. The copper ions do not possess any biological mechanism to halt natural lubrication or thin vaginal tissue.
So what's happening then?
To solve this mystery, we have to look at the demographics of when women typically get an IUD fitted.
Oh, so the timeline is the real culprit, not the device itself.
Exactly. IUDs are very frequently inserted during major hormonal life transitions. A huge percentage of women get a copper coil fitted postpartum, usually at their 6-week checkup, often while they're actively breastfeeding.
And breastfeeding changes hormones.
Dramatically. Breastfeeding naturally produces a hormone called prolactin, which severely suppresses natural estrogen production to prevent another pregnancy too soon.
Wow.
Yeah, the postpartum body is a profoundly low estrogen environment, which directly causes severe vaginal dryness.
And the other major demographic looking for a set-and-forget 10-year contraceptive option would be women in their late 30s and 40s.
Exactly. They are transitioning out of relying on the daily pill and want a long-term solution.
Right.
But this age bracket perfectly aligns with the onset of perimenopause. This is exactly when their natural ovarian function begins to fluctuate and their baseline estrogen levels begin to drop erratically.
I see where this is going.
Yeah, the dropping estrogen from these specific life stages whether it is postpartum breastfeeding or the onset of perimenopause, is the actual biological cause of the sudden dryness. The copper coils simply happen to arrive at the scene of the crime at the exact same moment.
That is such an incredible realization. Think about how many women have had a copper IUD removed because they thought the device was ruining their sex life, when in reality, their bodies were just entering a naturally low estrogen phase that needed entirely different support. It's not the copper, it's the calendar.
Very well put.
Let's broaden the lens a bit, though. We've established that hormonal drops, whether triggered artificially by the pill or naturally by life stages, dry out the reproductive tract. But if the synthetic hormones from oral contraception are traveling through your entire bloodstream, what else is caught in the crossfire? Where else are they causing a drought?
Well, they're impacting virtually every system that relies on fluid balance, lipid production, and mucus secretions. A great place to observe this systemic drought is the skin.
The skin.
Yeah. Hormonal birth control is famous for significantly reducing the production of sebum. Sebum is the oily, waxy substance produced by your body's sebaceous glands that coats, moisturizes, and protects your skin.
Which explains why dermatologists frequently prescribe the pill as a first-line defense for clearing up severe cystic acne. If you cut off the oil supply, you starve the acne-causing bacteria.
Right, it works wonders for acne management. But biology requires balance. You actually need a baseline level of sebum to maintain the skin's barrier function.
So what happens without it?
Without enough of those natural oils, water easily escapes from the tissue. The skin on your face, your arms, and your legs becomes chronically dry, deeply dehydrated, and highly sensitive to environmental irritants.
Jeez. And then there are your eyes. We reviewed a massive population-based study from 2021, and it concluded that hormonal birth control is a recognized significant risk factor for dry eye disease.
Yeah, the eyes are heavily impacted.
I don't think most people would ever connect their daily contraceptive to why their eyes feel gritty and tired at 3 in the afternoon.
The underlying mechanisms there are really intriguing. Oral contraceptives appear to reduce overall aqueous tear production, but more importantly, they degrade the lipid layer of your tear film.
Wait, tears have a lipid layer? I thought they were just salt water.
No, tears are a complex structure. The outermost layer is an oily lipid layer produced by tiny glands in your eyelids. This oil prevents the underlying water layer from evaporating into the air.
Oh, that makes sense.
When synthetic hormones disrupt those eyelid glands, the lipid layer thins out. The tears evaporate almost instantly, leaving the surface of the eye chronically dehydrated and inflamed.
That sounds miserable.
It is. And if the patient happens to wear contact lenses, the plastic lens creates constant friction on an already unlubricated eye, making the discomfort exponentially worse.
Here's where it gets really interesting. We take the pill to clear our skin, to feel confident, to manage our reproductive lives with certainty. But that tiny pill might secretly be the exact reason you are slathering on expensive body moisturizers after every shower and carrying a bottle of artificial tears in your purse all day.
Yeah. If we connect this to the bigger picture, it underscores a fundamental truth about human biology. Our bodies are deeply interconnected ecosystems.
Everything touches everything else.
Exactly. Tweaking a single systemic hormone to prevent pregnancy doesn't politely isolate itself in the reproductive system. It changes the fluid dynamics and the lipid profiles everywhere, from the meibomian glands in your tear ducts all the way down to the pores on your legs.
Which loops right back around to the issue of libido. When you combine the systemic dryness, the mood changes that often accompany synthetic hormones, the physical frustration of dry skin and gritty eyes, and the severe discomfort of dyspareunia, which is the medical term for painful sex. It all actively suppresses your desire.
It's a vicious full-body cycle.
So we've successfully diagnosed the problem. We've mapped how this hormonal drought affects the entire ecosystem of the body. Now, we have to equip you with the factual, evidence-based solutions from our sources to actually fix it.
Right, and there's a very clear tiered playbook for treating this, starting with over-the-counter options. And the absolute first step is understanding the profound difference between lubricants and moisturizers.
They sound like marketing variations of the exact same thing, but medically speaking, they serve completely different purposes, right?
Fundamentally different. Lubricants are designed purely for short-term, immediate friction relief during sexual activity. They sit directly on the surface of the tissue to provide a temporary glide.
Like water-based ones.
Yeah, you generally have the choice between water-based or silicone-based lubricants, both of which are safe for the body.
But there is a crucial non-negotiable warning in the medical guidelines regarding lubricants. Never use oil-based products like Vaseline, olive oil, coconut oil, or heavy body lotions if you are using latex condoms.
This is so important.
Yeah, the lipids in the oil chemically interact with the latex, degrading its structural integrity almost instantly. The condom will literally break apart, which drastically increases your risk of transmitting an STI or experiencing an unintended pregnancy.
That is a critical safety parameter. Now, compare those surface-level lubricants to vaginal moisturizers. Moisturizers are engineered to be bioadhesive.
Hold on, bioadhesive, meaning they're formulated to physically stick to the cells inside the body.
Exactly. They contain specific polymers that attach to the mucin and the epithelial cells lining the vaginal wall.
The epithelial cells are the surface ones, right?
Right, the barrier cells that make up the tissue surface. A moisturizer's job is not to provide friction relief for 10 minutes. Its job is to pull water into those epithelial cells, retain that moisture within the tissue itself over several days, and lower the vaginal pH back to a healthy acidic level to prevent bacterial infections.
So it's an ongoing treatment.
Yes, you apply them regularly, usually every 2 to 3 days, completely regardless of whether you are engaging in sexual activity or not.
So what does this all mean for you? If a listener is standing in the pharmacy aisle right now, completely overwhelmed by all the colorful tubes and bottles, what is the strict medical difference in when to use lube versus a moisturizer?
This raises an important question about how we manage our long-term tissue health versus a short-term immediate event. Think of it this way, lube is for the event, it's for intimacy. Moisturizer is for the environment, it is for your daily tissue health, cellular repair, and baseline comfort.
Oh, I like that distinction, event versus environment.
Yeah. You wouldn't only put heavy lotion on your cracked, dry hands right before you had to shake someone's hand. You would moisturize them daily to repair the broken skin barrier. The exact same logic applies to vaginal tissue.
That makes so much sense. But what if the over-the-counter bioadhesive moisturizers just aren't cutting it? Like the drought has been going on for years and the tissue is still too fragile and painful.
Then the clinical guidelines suggest moving to targeted hormonal treatments, specifically local vaginal estrogen.
Okay, local estrogen.
This is entirely different from the oral pill. Local estrogen comes in creams, small dissolvable tablets, or flexible rings that you insert directly into the vagina.
And because it is applied locally to the exact tissue that needs it, it bypasses the digestive system and the liver. You don't get the widespread systemic side effects that you might worry about with oral hormone replacement therapy.
Precisely. It absorbs directly into the vaginal epithelial cells to actively revascularize the tissue.
Revascularize.
It means it actually stimulates the body to rebuild the microscopic blood vessels that were lost, returning vital blood supply and naturally thickening the tissue back to its healthy state.
That's incredible.
It is, but patience is an absolute requirement here. The clinical data shows it can take up to 3 months of consistent, ongoing use to fully reverse the cellular atrophy.
Good to know.
Additionally, for some patients, doctors may prescribe local DHEA suppositories.
Wait, DHEA? That is a precursor hormone, right? So instead of just applying straight estrogen, you are giving the tissue the raw ingredients to make whatever hormones it is lacking locally.
That is a great way to summarize it. DHEA is an endogenous steroid hormone precursor. When applied locally to the vaginal tissue, the cells absorb it and convert it intracellularly into both estrogen and testosterone, depending on what the local tissue specifically requires to heal.
So smart.
Yeah, it provides a very targeted, balanced restoration without flooding the rest of the body.
And of course, there is the ultimate systemic solution if you are dealing with birth control side effects, which is alternative contraception. If severe dryness, painful sex, and loss of libido are ruining your quality of life, you do not have to just put up with it in silence. You can entirely remove the synthetic hormones from your ecosystem.
Exactly. We discussed the copper IUD earlier, which relies on an inflammatory response in copper ions, leaving your natural hormone production and your baseline estrogen completely intact.
Or if you want to avoid devices altogether, you can look into FDA-cleared fertility tracking applications like Natural Cycles.
Right.
These platforms use daily measurements of your basal body temperature to mathematically pinpoint your ovulation window, allowing you to manage your fertility without introducing a single synthetic hormone into your bloodstream.
The overarching message from all the clinical guidelines and patient surveys we reviewed is that women need to relentlessly advocate for themselves in the doctor's office. Do not accept chronic pain, severe dryness, or a vanished libido as just a normal tax you have to pay for managing your fertility. There are highly effective, scientifically proven pathways to resolve it, whether that is changing your contraceptive method or treating the tissue directly.
To briefly recap what we uncovered today, we have learned that hormonal contraception, particularly the combined daily pill, can cause severe systemic and vaginal dryness by altering your natural estrogen, suppressing your testosterone, and increasing SHBG, which locks up your remaining hormones.
Yeah?
Non-hormonal methods, like the copper coil, do not biologically cause this. The timing of their insertion simply tends to coincide with natural low estrogen life stages like postpartum breastfeeding or the onset of perimenopause.
Exactly right.
Most importantly, whether it is through a bioadhesive moisturizer that pulls water back into the cellular environment or local estrogen that physically rebuilds the local blood supply over a few months, this condition is entirely treatable.
The diagnostic tools are there, the physiological science is incredibly clear, and it is just a matter of finding the right therapeutic combination for your specific biology.
So as we wrap up this deep dive, I want to leave you with a final thought to mull over. Think about how much of our daily physical comfort, our shifting moods, our energy levels, and even our most intimate relationships are silently dictated by microscopic shifts in hormones that we rarely even talk about out loud.
It's profound.
It really is. If your birth control is fundamentally changing the fluid dynamics of your body's interconnected ecosystem, from the tears in your eyes to the deepest parts of your reproductive system, isn't it time you demanded an environment where you can actually thrive instead of just surviving a drought? Thank you for joining us on this deep dive. Keep questioning the established norm, keep learning about the incredible mechanics of your own biology, and please discuss any persistent or painful symptoms with your healthcare provider. Until next time.